The budget reconciliation process that congressional Republicans are using to cut Medicaid and Medicare may let them avoid a filibuster in the Senate, but the process also has a lot of rules, so let's talk about them. Reconciliation starts when each chamber of Congress passes a budget resolution with instructions to change spending, revenue, or debt. Then congressional committees write legislation based on those instructions, which get bundled into one bill. Here's the catch, though. In the Senate, there are several strict rules that together are called the Byrd Rule. In short, the Byrd Rule restricts every provision in the bill to those that strictly impact the federal budget. They also can't increase the deficit outside a set window, and there are certain subjects like Social Security that are off limits in a reconciliation bill. To enforce these rules, there's the Byrd Bath, which is a line-by-line review where senators can challenge different parts of the bill, and the Senate parliamentarian will then decide what stays and what gets removed. Already, several different parts of the reconciliation bill that the House passed have been removed from the Senate version because they violate the Byrd Rule. These restrictions will make it harder for Republicans to agree on a bill that not only can actually pass both houses, but is allowable under the Senate rules. But it's very important to understand that we can't rely on the Byrd Rule to stop cuts to Medicaid and Medicare. We also need to put lots of pressure on Senate Republicans if we want to stop this. We need your help to help us do that by using our hotline at 202-978-5357 to call your senator and tell them to vote no on the budget that cuts Medicaid and Medicare.